Spinal endoscopic surgery is one of the latest techniques to treat various spinal disorders, mainly disc problems or lumbar canal stenosis problems. In endoscopic spine surgery, we make very small or mini cuts. Through that, we use endoscope to look into the problems of the spine and deal with the problems accordingly. In endoscopic spine surgery, first and foremost is we examine the patient and decide whether this patient needs endoscopic spine surgery or not. Once the decision is made that patient needs endoscopic spine surgery, certain tests are ordered for that patient, and patient is advised to meet our anesthetist, who will give him or her a pre-anesthetic clearance. Then patient is listed for endoscopic spine procedure. Procedure is done under either general anesthesia or under local anesthesia, and procedure usually lasts for about 45 minutes to 1 hour. And once the effect of anesthesia is gone, these patients are advised to sit and walk around, and usually these patients are operated in the morning and they are able to walk back home in the evening. So these are basically daycare procedures where patient really doesn't have to stay indoors for 2 or 3 days even. Patients are usually followed up on day 3 to see if wound is okay, there is no problem with the wound. Then they are taught certain exercises. Subsequently, they need not come for follow-up, but they are interviewed on telephone, or they are told that if there is any problem, they should visit the center. But routinely our follow-up lasts up to 2 years. At 6 weeks, 3 months, 6 months and 1 year, we usually conduct a telephone interview. If there is a need to call this patient to center, then we tell them to come, or if otherwise patient feels that he has a problem, he reports to the center. Otherwise they really don't have to visit the center time and again as far as follow-up is concerned. So this is again advantage to a patient, where he doesn't have to come for repeated follow-ups to a hospital or a center.